I want to welcome everyone. I am Ann Garst-Taylor. I am stepping in for Sam Guild, who is the Skin Cancer Education and Research Foundation president. She sends her apologies that she cannot be here this evening. She really wanted to, but she is flying in the air back from a meeting. More importantly, she wants to send her appreciation to the Moffitt Cancer Center for co-hosting this evening's symposium. We know it's going to be wonderful. It's the second in a series of 4 non-melanoma symposiums that we will be co-hosting this year. I'm going to be back a little later to talk about the Skin Cancer Education and Research Foundation, which we call SCIRF. But my role at this point is to explain how the question and answer section will go. We know everyone will have lots of questions for our panelists this evening. And so if you are viewing this evening via Zoom, then if you will look at the bottom of your screen, you will see a comments tab, but also a Q&A tab. We ask you to put your questions directly into the Q&A tab. If you are joining us through Facebook, you can put your comments there in the comment section, and we will transfer them over to the Q&A section in Zoom. And with that, I am handing the baton over to Dr. Sondak so he can start this evening's symposium.
Thank you very much. It's a real pleasure to welcome you all virtually to Tampa, Florida, and our McKinley Outpatient Center for Cutaneous Malignancies. We're going to talk today about living with non-melanoma skin cancer. We wish we could have you here in person because there's a lot of exciting growth at Moffitt. We're about to open a brand new hospital right across the street from our clinical center. You can see it here. Our outpatient center is in the right foreground. The bridge across McKinley Boulevard and our new hospital will open on July 31st, and we're very excited about that. So for some of you who come see us in person, you'll be seeing this building, and you'll be seeing a lot of the activity that goes around the imminent opening of that. But for today, we're talking about non-melanoma skin cancer. What is that? What does that mean? What is it, non-melanoma skin cancer? First of all, these are my disclosures. But what I really want to talk about is what kinds of skin cancer are we talking about, and how does that impact our patients, and why is it non-melanoma skin cancer? Well, first of all, skin cancer is really, really common. Pretty much half of all cancers in the United States each year are skin cancers. More than 3.5 million new cases in the United States. And anyone will have to admit that any number we tell you about skin cancer is just an estimate, because as you'll see, there is no single place where anyone keeps track of all the skin cancers that occur in this country. But the thing that most skin cancers have in common is the sun, and the sun is not your friend. If you haven't learned it by now, you'll have learned it by the end of this symposium. That is for sure. Melanoma is what we're not talking about today. Melanoma is very common and is getting more common in the United States. And if nothing changes about our habits, how much we spend time in the sun, and whether we use sunscreen or not, and whether we use tanning beds or not, if nothing changes, it's been estimated that by 2040, melanoma will become the second most common type of cancer in the United States and the most common in men. But that's of the major types. Remember, take all of these cancers, lung cancer, pancreas, lymphoma, thyroid cancer, add them all up, and you still have just the same number as the non-melanoma skin cancers are. So with melanoma, non-melanoma skin cancers, we have a real epidemic in this country. In fact, it's estimated that 1 in 5 white Americans will develop some form of skin cancer in their lifetime. Down here in Florida, it's probably even more than 1 in 5. So very, very quickly, The skin is composed of several different types of cells, and that's where these different types of skin cancers get their name. The basal cells are shown they're at the bottom of the epidermis, and the arrow points to a basal cell. That turns into basal cell cancer, which is an example is on the left. Squamous cells are in the middle of the skin, and the squamous cancer is in the middle. And melanocytes are what cause melanoma. Basal cell carcinoma is the most common skin cancer. We're going to hear from Dr. Ruggiero Neves about that in just a moment. Squamous cell cancer is the second most common. And as we said, over 3 million cases each year. I said we can't give you an exact number because the Cancer Society, which tracks all those other cancers that I was talking about, just gave up. In 2012, they just said, we can't do it anymore. And they've stopped trying to keep track. So the last numbers we have from the Cancer Society were 2011. We have some numbers from Medicare and other places, but it still remains a mystery what the exact number of these cases. So how can we stop calling non-melanoma skin cancer what it isn't, which is it isn't a cancer of melanocytes, it isn't melanoma? Well, basal and squamous cell carcinomas are keratinocyte cancers. That's kind of what they are. Keratinocytes are skin cells. So we like to use that term, keratinocyte cancer. And you may well be hearing that. There's another kind of cell in the skin, and that's the Merkel cell. But Merkel cells aren't shown on any of these pictures. They're hard to find without a special technique. And we don't even know if Merkel cell cancer comes from Merkel cells. We're going to hear from Dr. Tsai later today about Merkel cell carcinoma, from Dr. Zager about squamous cell carcinoma, and we're going to try to tell you about what it really is and not about what it's not.